are able to continue these clinics administering either Moderna or Pfizer. So between now and Monday, between tomorrow and Monday, there are a minimum of 8 mobile clinics happening throughout the city of Hartford where Moderna or Pfizer will be administered, and that's in addition to the multiple fixed sites where you can get vaccinated by appointment and where our team is working every day to schedule appointments. Our health department will be holding a walk-up clinic, no appointment necessary, tomorrow next to City Hall, right out here on Burr Mall, and we'll be administering about 200 doses there. And the remainder of those mobile clinics will be either in partnership with the state and the mobile van that Griffin Hospital is running, or through FEMA, which is working in partnership with Trinity Health, and will be in Hartford beginning on Friday. So for those clinics, again, a number of clinics, all of them are available on our website, hartfordct.gov. You can get the full list. To schedule appointments at those clinics, you can go to 211. You can call 211. That is the way to schedule those appointments. We encourage you to schedule an appointment, but either way, every single one of those clinics will be accepting walk-ups as well. So again, we have been working hard as a community with all of our partners to make vaccines and vaccine clinics as accessible as possible, to eliminate every barrier. And even with this pause, which we all hope will be short on the administration of J&J, we've been able, through those partners, to shift to Pfizer and Moderna and continue that very, very robust schedule of clinics this week. I also just want to briefly address the pause, the FDA's guidance and the state's decision today. Look, I think it should give everybody an extraordinary amount of confidence and comfort that the FDA is pausing when there were only 6 out of 7 million vaccines that resulted in adverse reactions. That is an extraordinarily small number of adverse reactions. I think the FDA's guidance is a definition of an abundance of caution, an extraordinary abundance of caution. And so we certainly hope that this pause will be brief, because the one-shot J&J vaccine has continue to be an important part of our overall effort to vaccinate our community, to vaccinate our country, and put this pandemic in the past. I will pause there, ask Councilman Clark, who these days wears 2 hats, both as City Councilman and as a key member of the Charter Oak Health team that is holding vaccine clinics around the city, to offer a few words as well, and then happy to take any questions.
Thank you, Mr. Mayor. My name is Councilman T.J. Clark. I serve as the city's majority leader for the City Council, and I just want to speak to the residents as a member of the Hartford City Council and also to a member of the Health and Human Services Committee. Even though we do have a pause right now for the Johnson & Johnson Clinic, I would encourage all residents who have scheduled an appointment to receive a vaccine to still keep their appointments and to contact their local health provider who is administering the clinic to make sure that they are going to be switched to a different vaccine. Right now, we want to achieve that number of herd immunity, and this is just a temporary stop. So I want to really encourage people, as they are, I know, still trying to figure out if they want to become vaccinated. This is just a small stopgap, and just please reschedule your appointment. Don't reschedule your appointment, sorry, just keep your appointment and make sure that you get vaccinated, because we want to make sure that our whole community in our city is vaccinated. And I just want to commend the mayor, his team, as well as the Director of Health and Human Services on the great work that they have done, and our healthcare partners in the city on providing such an enormous amount of clinics in our city. And to all my fellow Hartford residents, please don't worry. You're in good hands with the mayor and the rest of his health team. Thank you.
Thanks so much, Councilman Clark. I just want to briefly read the clinics that we have, so everybody knows. Today, Charter Oak was across from the ballpark, and I think they're going to be holding another clinic later this week, or likely holding another clinic, assuming that they're able to shift those vaccines. But in addition to the Hartford Health Department's clinic on Burr Mall tomorrow, which is from 2 p.m. to 6:30, there's also the State Department of Health clinic at the Wilson Gray YMCA on Albany Avenue on Thursday from 10 to 4. The same clinic at the Sportsman's Athletic Club on North Main Street from 10 to 4 on Friday. At St. Augustine Church on Campfield Avenue on Saturday from 10 to 2:30. And the FEMA clinic, which will be at Wish School on Barber Street from 11 a.m. to 7 p.m. On Friday and Saturday, as well as at St. Lawrence O'Toole on New Britain Avenue on Sunday and Monday, again from 11 a.m. to 7 p.m. So the main message is, if you've got an appointment, keep that appointment. Every provider is working hard to shift from J&J, if that was what was planned, to Moderna and to Pfizer. And if you don't yet have an appointment, but you're a Hartford resident, you want to get vaccinated, go to one of those clinics, because every single one is accepting walk-ups, even if you don't have an appointment. So again, the effort continues to make this vaccination campaign as accessible and as easy as possible for everybody. We got to keep our foot on the gas and move forward as fast as we can to beat this virus in this race against the variants. So thank you. Happy to take any questions.
In terms of making that switch from J&J to Moderna, how easy was that? I mean, were you on the phone today trying to work it? I mean, how much extra supply is there?
I think every partner who has any role to play in the administration of vaccines was on the phone and working with the state to try to make sure that that shift could happen. As I always do, I want to give enormous credit to the team at the state. Our public health commissioner, Josh Jabal, Michelle Gilman, everybody who's over there working, they've been tremendous partners, and they worked very, very quickly to try to make it possible for clinics to administer Pfizer or Moderna while this pause is in place.
Do we know how many Johnson & Johnson doses are being shelved right now in Hartford?
I don't know if I can tell you how many are being shelved. I mean, I think I can tell you that we had a couple of thousand that were likely to be administered this week. But I don't think any of them are, again, there does not appear to be any problem in the production. What the FDA has said is that they're pausing so that they can issue the appropriate guidance to healthcare providers and to those administering vaccines to make sure that there are the right protocols in place. Again, in the extremely rare event that there are adverse reactions. I mean, it really is worth just pausing again on that number. They are pausing because out of the 7 million vaccines administered, there were six adverse reactions. It's really important to make sure everybody keeps that in mind, and I think everybody is focused on, appropriately so, on health and safety, and we hope that this pause will be brief as that guidance is completed.
The governor is hopeful that it will only last a few days.
Yeah.
And we'll get back into process again. Do we have an expiration date as to when these doses that are currently being?
I can't answer that question. Yeah.
I know one big benefit of Johnson & Johnson, one and done. It was going to be like really key,
Right.
especially to get to some areas. Do you have some concern, especially some of these other vaccines are a little bit logistically a little bit more difficult?
Like I said earlier, Johnson & Johnson has been, and I hope will continue to be, a really important tool in our effort to vaccinate our country and our community. And it is particularly valuable to reach, those who may be harder to reach, and it's important when you're doing our walk-up clinics. One of the main virtues of those walk-up clinics is you can come by, get vaccinated, and there's no need for that follow-up. You don't have to, the provider or the administrator doesn't have to, schedule you, get back in touch. You're vaccinated and you're done. So, like the governor, I am hopeful that the pause is brief and that we will soon be able to administer J&J as a part of that suite of vaccines that are being administered across the country, because it does have a really important role to play.
Are you concerned at all about how this is going to play a role in vaccine hesitancy here in the city? You guys fought so hard.
Yeah. Well, so the question is about, are we concerned that this will, exacerbate vaccine hesitancy. That's why I really stressed that number. I think it's so important for people to understand that it is an extraordinarily rare occurrence that there's any adverse reaction here. Also remember, our public health commissioner in the state of Connecticut got the J&J vaccine. I mean, the vaccine is effective. All of these vaccines are effective, and it is very clear that the FDA is acting out of an extraordinary abundance of caution. But as I said earlier, if anything, I think this should give people even more confidence, because it is clear that they are being extraordinarily careful and extraordinarily focused on safety. For them to encourage a pause because there have been 6 adverse reactions out of 7 million should give everybody an extraordinary amount of comfort and confidence that safety is the primary focus, and hopefully we'll be able to continue administering those vaccines along with all the others so that we can continue to protect our community and move beyond this virus.
Do you know how many clinics have had to shift to Pfizer and Moderna?
I can tell you the number. A number of the clinics that I just referenced were planning to use Johnson & Johnson. Again, because of that ease of administration when you only have to give one shot. But I couldn't give you a total number. Okay? So again, if you have not been vaccinated and you're in Hartford, you want to get vaccinated, please come down to one of these walk-up, no appointment necessary clinics this week. Get vaccinated. If you need that list again, you go to our website at hartfordct.gov. If you want to schedule an appointment for the FEMA site coming to town, you can do it through 211. And our team is going to continue to be out there knocking on doors, making phone calls, scheduling appointments, not just at these clinics, but at the fixed sites that are administering vaccines by the thousands every day here in the city of Hartford. Thanks so much, everybody.